Hello everyone, welcome to CAPSA. Today we will understand about the pharmacology of penicillin. So penicillin are the group of beta-lactam antibiotics that were first true antibiotics discovered by Alexander Fleming in 1928. They act primarily against a gram-positive bacteria, and their main mechanism involves inhibition of bacterial cell wall synthesis, which leads to bacterial lysis and death. Now we will look at the structure. So the basic structure of penicillin consists of a beta-lactam ring fused to a thiazolidine ring along with a variable side chain or R group. And this side chain determines the antibacterial spectrum, resistance to acids or beta-lactamase enzymes, and pharmacokinetic properties of each penicillin derivative. Now we will quickly look into the classification. Okay, so penicillins are classified into several groups like natural penicillins, penicillin G, penicillin V, mainly effective against gram-positive cocci. Penicillinase resistant anti-staphylococcal penicillin, those are methicillin, oxacillin, cloxacillin. They are resistant to beta-lactamase produced by Staphylococcus aureus. Aminopenicillins or ampicillins and amoxicillin have an extended spectrum covering some gram-negative bacteria. Antipseudomonal penicillins like ticarcillin and piperacillin, they effective against Pseudomonas aeruginosa and other gram-negative organisms. Combined preparations are amoxicillin clavulanic acid, ampicillin sulbactam, piperacillin tazobactam. These contain beta-lactamase inhibitors that protect penicillin from enzymatic degradation. Now we will look into the mechanism of action. Okay, so mechanism of action. So penicillins act by binding to penicillin binding proteins or PBPs, which are the enzymes involved in the final stages of bacterial cell wall synthesis, and they inhibit the transpeptidation reaction, and thus they preventing the cross-linking of the peptidoglycan layer. This weakens the bacterial cell wall, leading to cell lysis and death. Penicillins are therefore bactericidal, especially against actively growing and dividing bacteria. Now, what are the resistance mechanism? So, bacteria may develop resistance to penicillin through several mechanisms. Production of beta-lactamase or penicillinase enzymes that hydrolyze the beta-lactam ring, rendering the drug inactive. Alteration of PBPs leading to decreased affinity for penicillin like in MRSA. Reduced permeability of the bacterial cell wall, especially in gram-negative bacteria, and another one is efflux pump that actively removes the drug from the bacterial cell. Now we will look into the pharmacokinetics, okay, or ADME. So penicillin G is acid labile and must be administered by injection or IM or IV route, whereas penicillin V and amoxicillin are acid stable and can be given orally. They are widely distributed in body tissues but penetrate poorly into the cerebrospinal fluid unless the meninges are inflamed. Most penicillins are excreted unchanged by kidneys, mainly through tubular secretion. Hence, dose adjustment is needed in renal impairment patient. Now, what are the adverse effects? So, the most common adverse effect of penicillin is hypersensitivity reactions, which can range from mild rashes to severe anaphylactic shock. Other side effects include gastrointestinal disturbances such as nausea, vomiting, and diarrhea, especially with ampicillin and amoxicillin. Superinfections may occur due to overgrowth of resistant organisms like Candida or Clostridium difficile. High doses can cause neurotoxicity and seizures, particularly in patients with renal failure. And in patients treated with syphilis, a Jaris-Hersheimer reaction may occur due to release of toxins from dying spirochetes. Now, what are the therapeutic uses? So, penicillin G is the drug of choice for syphilis, streptococcal infection, and meningococcal infections. Cloxacillin and dicloxacillin are preferred for staphylococcus infections resistant to natural penicillins. Amoxicillin is widely used for respiratory tract infections, otitis media, urinary tract infections, and in Helicobacter pylori eradication therapy. Piperacillin and ticaracillin are used for severe gram-negative and pseudomonal infections. Amoxicillin and clavulanic acid combination is used for infections caused by beta-lactamase producing bacteria, that is Haemophilus influenzae and Escherichia coli. Now, what are the drug interaction? So, probenecid inhibits renal tubular secretion of penicillin, thereby increasing its plasma concentration and duration of action. Tetracyclines may antagonize the bactericidal effect of penicillin by slowing the bacterial growth. Penicillin may also reduce efficacy of oral contraceptives by altering intestinal flora involved in hormone metabolism. Now, coming to the end, what are the main points we have learned today? So, penicillins are bactericidal, time dependent antibiotics that act by inhibiting bacterial cell wall synthesis. Probenecid can prolong their action. Allergic reactions are their major adverse effect. Penicillin G remains the drug of choice for syphilis and rheumatic fever prophylaxis. Resistance may occur due to beta-lactamase enzyme production or altered PBPs. So this is the today's lecture. If you like this video, share with your friends. Thank you for staying with me.